Well, Chilliwack is an amazing hospital. It's GP run, and it allows that connection to the community and to the patients. And so as a general internist, I have the opportunity to work with this amazing group of GPs and work on interfacing the general internal medicine service to these wonderful connections within the community.
I moved to Chilliwack 13 years ago. I actually moved here to do my training at the Chilliwack residency site. Didn't plan to stay here indefinitely, planned to stay for 2 years only, and ended up just really liking the community and starting a family here. My husband had a good career here, and so we decided to stay in Chilliwack.
I actually emigrated from Africa in 2000. Straight to Hope, BC, which is a small community which I loved. I raised my children there. But as they grew older, I needed to take them somewhere where there was more activity for the kids as they went into high school. So I decided to move to Chilliwack, which was close enough to Hope for my patients to come and see me from Hope, but also a city where I could help my children attend extracurricular activities that they couldn't do in Hope.
Well, it didn't start at the hospital, it started in the community. I did my residency in this community, and the collegiality spoke to me. And for the most part, I have practiced general practice medicine here for 23 years. It's been an incredible journey for me.
The main reason for that was just how much I could do as a family doctor here in Chilliwack. So I work in my office, I come to the hospital every morning to see my inpatients, I do some hospitalist work here in the hospital, and I do obstetrics as well. So it gives me a lot of scope of practice. I really enjoy doing minor procedures and ambulatory daycare here in the hospital. Also really enjoy continuing to do nursing home and residential care. And that's the thing that has been really challenging, I know, for other communities, is to maintain that full scope. And many of my colleagues don't do hospital work, and that's okay. We really make it work for everybody. So there's something for everyone here in Chilliwack, and the community is just very supportive, very collaborative.
General internal medicine here has really found a niche in trying to find new and better ways to look after patients, really trying to advocate for patients, and really trying to utilize our resources here in the community to the maximum, so that way patients can have access to as many services out here as possible.
When I came to Chilliwack, I first thought this is going to be different. There's a lot of doctors. How will I get to know them? How will they know me? But as I worked here, I found that it's really a great team. They made a big effort to incorporate me into the team. So there was always a hello in the hallway, and are you doing okay? What did you think of this patient, etc. So I got incorporated really easily. And then with the specialists, they're awesome. Like, you can approach them, whether it's by phone or physically, they always have time for you.
And it's a real pleasure to come to work every day, see my patients, work with the nurses, the physios, the OTs, the people in lab, my colleagues in medicine who are supportive, and we work together. When there's hard work to do, we basically all row the same boat. It's meaningful work, and I really enjoy it.
The biggest thing that gets me up in the morning and makes me excited to come to work is the colleagues. Working with the GPs, working with the surgeons, working with the intensivists, the electrophysiologists, and the nurses. This collaborative team environment here is really what gets me up in the morning. One of the big things that we're working on in general internal medicine here in Chilliwack is team-based care. Team-based care is really, how do we make Chilliwack patient-centric, but also an inspiring, collaborative environment where we feel connected to our colleagues, to our physicians, to our nurses, all in the name of improving patient care. And that connection with these people that I work with, that I care about, is really what gets me up in the morning and makes me want to come to work.